a consultant obstetrician and gynecologist, and you have a book coming out this year, which is called Mind the Gaps: Cases in Gynecological, Sexual and Reproductive Health. So I guess then the subject of women's health is something that you are obviously very well placed to talk about. So I just wanted to ask you a few questions on women's health. And
Sure.
first of all, do you feel that women's health in general gets the emphasis that it deserves and needs?
So I think there's room for plenty of improvement. So if you look at advertisements and the media, there's a lot about heart disease and cancer, these really hard-hitting subjects. But actually, when it comes down to it, women's health could do a lot better with more promotion, more education, more prevention. And I think we really need to up the profile of women's health, not just in this country, but overall. And again, it comes back to us promoting its profile, getting the messages out there so that girls and women feel empowered. Because let's be honest, talking about periods, despite it being the 21st century, is not always easy.
Mm-hmm.
And yet actually it should be. How is it easier for me to talk about high blood pressure or heart problems than it is about having heavy periods? And that's part of the biggest problem that we actually face. Once we break down those barriers and get people talking about women's health problems, that's going to be the biggest step to then addressing them effectively.
Mm-hmm. So do you think, what more do you think can be done to kind of raise that profile of women's health? You mentioned talking about things, breaking down the barriers.
Well, I really think it starts from a young age. So sex education at school and really just detaching any stigma and concerns around talking about periods, sex, pregnancy. These are actually common things that everybody is busy doing in life. So why are we so shy to talk about them? So there's a lot of work to be done with schools, but also in general, looking at adverts on TV, on the radio, Instagram, Twitter, publications, various different cancer awareness weeks are great, but we need more work to be done. And we need women to be comfortable going to their doctor and talking about these things. So there are different elements, mainly around communication and education. And I think really it takes time for people to feel comfortable enough to talk about it, which is why schools and education is really important. That's when the attitudes and approaches to our health are really set.
Mm-hmm. And talking about education, how do you feel it's handled within medical education and undergraduate training? Is it something that is given enough time?
Well, that's a really good question. So the undergraduate medical curriculum has just grown and grown over the last decade or two. And actually, in some ways, I feel sorry for today's medical student because they are expected to know so much about so many different things. So it's really hard to get big, chunky subjects such as women's health into the curriculum with enough time devoted to it. So it's about really maximising the time that you have. And certainly when I speak to students, it's about making sure they appreciate quite how sensitive a subject women's health can often be. It's not just the theory that we're learning as medical students to be doctors for our exams. This actually affects the health of the person you're talking to who you've never met. And within 2 or 3 minutes, you're dealing with some quite sensitive and almost embarrassing subjects for them. And it's about us being doctors who are able to be approachable, be that person that women can talk to about some delicate subjects, which they may not be able to talk to their spouse about or their family about. That takes time. So in answer to your question, I think there's a lot that we can do within the curriculum. Yes, there's a limited amount of time, but again, it's getting the clear messages to tomorrow's doctors to make sure, yes, they know the background history to women's health and the problems, but 50% is whether the patient actually gets on with you and wants to open up to you. So knowing that, I think, is the biggest hurdle in women being able to open up and talk about sex and problems having sex or having babies, etc.
Hmm. That's great. I think you've probably covered this question, Shree, but I will ask it anyway. What do you think are the biggest challenges with regard to women's sexual and reproductive health?
I think women getting the information they need, that is the
Hmm.
bottom line. Some women are just feel very uncomfortable. They're just very shy about talking about women's health. I see this as a woman doctor. So if they then go and see a male doctor, I can imagine how inhibited they can feel. So
Hmm.
firstly, being able to approach the right person and knowing where to get information from. And yes, the internet is great, but you and I both know that can be quite a scary place at times.
Dangerous in the wrong hands.
Exactly. Too much information sometimes is not necessarily a good thing. So making general practices, hospitals, clinics far more accessible and approachable for women, I think is going to be important. And part of that, I guess, also comes down to waiting times. You know, we've just gone through COVID-19, making sure that the services are up and running and are there for our women in the next 12 months is going to be particularly important, I think.
Fantastic. So then conversely, on the other side, what have been the biggest steps forward in these areas in the last decade?
Well, interestingly, again, it comes back to the media. So if you look at the biggest advances, yes, we are progressing with the scientific side of things, of course, but women don't often know that. So the internet, from that perspective, things like these interviews, these bite-sized interviews, which perhaps wouldn't have been available 5, 10 years ago, or more difficult to access, have been increasingly important. So the audience that you can actually get is fantastic. So it's about using that better. And also just looking at how much more this generation actually care about their health. And let's be honest, after a year of lockdown, one of the biggest things that we've come out with is the importance of health. So we really need to capitalise on that and keep that momentum going.
That's great. Thank you, Shree. Just one last question then around women's health. And this one is kind of personal. What do you regard as the most significant achievement for women in science and medicine within the past decade?
I would have to say it's around something called HPV screening. So that's part of the cervical cancer screening program. And I've studied the figures and looking at where we were in the late 1980s and where we are now. Oh my goodness, you know, that little test that we are invited to go and attend for at our GP free of charge every 3-5 years, amazing. And because of that, our cervical cancer rates in this country are one of the lowest in the world. And that is a statistic that we should be very proud of. And you can really see the difference between our effective screening program and countries that don't have an effective screening program. So my biggest advice to women would be definitely go for that smear test. It's 2 minutes of your life. I know it's not fun, but then it's done. That's it. Yeah, very proud of the UK screening program there.